Thanks very much, everyone, and good evening. Glad to be with you all talking about the economic costs of COVID. I've put in the subtitle here, life, income, productivity, and health spending. That'll become a little bit clearer as I go on. But I wanted to begin with a quote from a recent article in Nature that says, the oncoming burden of long COVID faced by patients, healthcare providers, governments, and economies is so large as to be unfathomable. If people are saying this, you would think we would be responding to it, although the way we've been responding to climate change may be a bit of a tell that we don't necessarily act rationally in that way. But why, we hear from the health authorities that most people recover, that we look at the data and we don't see people dying left, right, and center anymore. So why is this oncoming burden unfathomable? If you break down the economic cost of COVID, there's the loss of life, the lost quality of life. These are people, if you don't recover quickly, the lost income. If your recovery means that you can't work, or you can't work as much as you used to, other things like that. Lost productivity if companies can't find workers, or if things are delayed, all this kind of stuff. Increased health costs, meaning how much more we have to pay to get treatment. So those are the sort of categories of economic cost that I'm going to go through. And I'm going to start very briefly with the first one. I'm mostly interested, to be honest, in the lost income. This is just very briefly to remind everyone we're up to. We've had over 20,000 deaths, comfortably over 20,000 deaths in Australia. You can see it really began when we stopped trying to contain COVID around when Omicron came on. We've had 8 waves of hospitalizations in Australia. These first two, this is the original, then here is Delta, and then here is roughly where we stopped trying to contain COVID, and then these are 6 waves of Omicron. And you can see the bottom of each of these waves of hospitalizations very rarely comes much below the peak in the Delta waves. So clearly it's ongoing, and the fact that we keep having these repeated waves is really the most important part around why the long-term cost is mounting. Right, each one of these waves is creating more people with long-term illness. And that's a cost, economic cost that just keeps mounting. You can see, comparing the same hospitalization with the UK, we're now doing just about identically with the UK what they're doing in terms of hospitalizations per capita. This is per million people, I should say. The UK had these 2 very big waves in the beginning that we didn't have, but now we're basically doing roughly exactly the same thing as they're doing. Because of that makes the UK data quite instructive, and the UK Statistical Office has done quite a lot of looking at the labour market implications. So I'm going to go through some of that in this section, and this is the section to me is most interesting. I mentioned the repeated waves. Each time you get infected, there's a certain amount of risk of getting long COVID. If you keep rolling the dice that way, the risk keeps accumulating. So it's common to think of long COVID as maybe 5 or 10% likely per infection. So 5% is this orange line here. If you assume that each infection creates a 5% risk, and then across the bottom, you've got the number of times you're infected, and you just keep reading up to find the cumulative risk, right? So at 1 infection, it's 5% risk. At 2, it's 9 and a bit. By the time you're up to, 14 or so, you've got 50% chance of infection of long COVID. And this is one of the most important concepts to understand how the cost just keeps mounting, right? If we keep having wave after wave after wave, people are just moving up and up this curve into a position where they're almost guaranteed to have long-term health problems. And what does that do in the end to the economy? The UK as I said, has been looking at the consequences pretty starkly. This is the number of people who are no longer economically active um, due to long-term sickness in the UK. And you can see going back to 1988 and 1998, it's been trending down since then. Um, it began ticking up again just before COVID. So there's a little bit of something going on there that's not just COVID necessarily. But if you project the trend from 20 years leading up to COVID and just push it forward, what you're left with, is about 600,000 people more than would have been economically inactive. So these are working age people aged 16 to 64. This is not people over 80 or something like this. This is all people who would be working but aren't working because they've got a long-term sickness. And the reason I like looking at the data this way is because it doesn't say this is from COVID, but it very clearly changed when COVID came. And so whether they're sick with COVID or whether they're sick with something else that they've got because of COVID, or whatever it happens to be, we can quite clearly see that there's a huge drag on labour supply with people just not being able to work. So before the pandemic in the UK, long-term sickness was the cause of about 22% of economically inactive people. I mean, the reason that they weren't working was because of their sickness. Now it's 29%. So you've had a 7 percentage point increase in the number of people not working because of long-term sickness. At the same time, in the UK, there's been 5 percentage points increase in the number of people reporting at least one long-term sickness. So before the pandemic, you had 31% of Brits saying they had a chronic illness. Now it's 36% of Brits saying they had a chronic illness. This wasn't a rapidly changing number, right? It was fairly stable until COVID came along, and now it's jumped. And the number of people with 5 or more health conditions has also jumped from 660,000 to 930,000. So we're now talking about nearly 2% of the UK's working age population with multiple long-term illnesses. They have 33 million people employed. So when we're looking at 500,000 or 600,000 people out of 33 million, we're talking about a couple of percent of the labour force in the UK. We can see the increase in long-term. This is the increase in long-term sickness. Is the green bars. You can see it coming through during the pandemic years. This from 2020 through to 2023, and these are all economically inactive people by different reasons. And the green bars you can see has come to dominate as the main reason that people give. This is looking at the same data by age, and what you can see with this is that at the beginning of the pandemic, a lot of people who weren't working in the UK were younger people, and that's what you expect during lockdowns and stuff like this. But then, as the pandemic's gone on, the number of people who aren't working has increasingly been the sort of older working age people and the sort of prime of career people. So you can see the 35 to 49 year age group starts creeping in. There's quite a bit of people in their 20s and 30s here as well in the second half of the pandemic. And the number of people in the sort of 50 to 65 just keeps going up as well. So, what's happening here is it's not due to all the lockdowns and stuff. People have been getting sick, and the sickness keeps mounting. And the older you are, the more susceptible you are for those sicknesses to mount to a point where you can no longer work. It doesn't affect the same sector equally either. This is still in the UK. There's been an enormous increase in the number of teachers who are absent due to sickness, 50% increase since pre-pandemic levels of teachers, and a similar situation with doctors in the UK. There's a recent survey found that 60% of doctors said that ill health after COVID had impacted their ability to do basic activities. half of them said they've lost earnings due to COVID. Oops. And the UK, these are two sectors that basically everyone is having shortage of, is teachers and healthcare workers. The UK is experiencing that extremely acutely. So starting to turn that into economic cost, right? There's a lot of different ways you can think about it. One is just the number of days you've lost, but then you can think about that, each day as an average salary and turn into an income. You can see again, the number of days lost to sickness was going down every, year on year from mid 90s through to the pandemic, and then it's just jumped. So there was that period, I guess, from 2011 to 2019 where it kind of stabilized around 135 million days a year lost to sickness. And now it's up at around 185 million days a year lost to sickness. So we've got 50 million extra days of work lost, 10 million weeks of work lost last year in the UK. So out of 33 million working people, it's basically as if 1 in 3 people lost a week of work due to sickness that otherwise would not have. And then, as I mentioned earlier on, the way this keeps mounting up, right? So here we've got the prevalence of COVID in the UK. The blue line is normal COVID, right? Acute COVID. The red dots that become yellow dots are long COVID. So there's a couple of things going on. The reason those dots are yellow is because they've changed the definition of long COVID from, I think, 4 weeks to 12 weeks at that point. So the red dots are how many people in the UK, as a percentage of the entire population, have had at least 4 weeks of being sick with COVID, and then at least 12 weeks once it becomes yellow. So you can see it just keeps heading up. If these yellow dots were 4 weeks, obviously it's much fewer people with 12 weeks of symptoms than with 4 weeks. So this is a little bit misleading. This would probably be heading up in a straight line here, and showing how every time you have another wave of acute infection, it just adds the number of people into that category of chronic sickness. This is from the US now. And this is an estimate from the Federal Reserve, I think. They've estimated a shortfall of 3.5 million workers due to COVID. This is a little bit old. This is from the third quarter of last year. So there's been, 3 quarters since then, almost a year since this came out. But this is the US Federal Reserve estimating 3.5 million workers fewer than they would have had. That's more than 2% of the US workforce missing. You cannot take out 2% of your workforce and not have an economic consequence. You can effectively say that it's 2% of GDP, because assuming that all those people were earning the average income, or on average earning the average income, there's nothing special about this group of people relative to the general population. You can just apply the average income to it, and if you've lost 2% of your workforce, you can apply that to 2% of income as well. Jerome Powell, the Fed chair, has said that around 400,000 workers died of COVID in the US. This is not 400,000 people. There's 400,000 workers. These are not people that were, already retired, and someone might say that they were going to die next year, but they instead died this year. Right? We're not talking about that situation at all. 400,000 working age people is a huge number of people to lose in a year. So the other 3 million workers are still alive, but about 2 million are estimated to have retired early. Why? They can't work. The other 1 million are mainly from reduced migration. So we've had about 500,000 workers die, about 2 million retire early or withdraw from the workforce, and another million who never arrived in the country at all. You see again, this is still in the US, the number of people with disability just going up from 2020. I guess for the sort of 5, 7 years leading up to the pandemic, it's fairly stable. And then from 2020 to 2023, there's just this huge increase, going from about 30,000 to 30 million to 35 million people with disability in the US, just in the space of 2 years. And there was no such growth like that before at that rate. This is from the Brookings Institution. It's also a little bit older, but they've taken basically what we're talking about and applied some wage estimates to it, and they've taken 3 different estimates of how many workers are out of the workforce. The Fed analysis that had 1.8 million workers missing, TUC, I'm not sure who they are, 2.9 million, and then you've got a report from the Lancet that estimated 4.1 million people out of work due to long COVID, and then they've applied an income multiplier to it, and they're estimating the economic burden approaching or over 200 billion a year, and likely to keep rising. There's, I think, based on a average US wage of $1,100 a week, and we're talking about around 1% of US total GDP. So that's for last year, right? That's what's already happened. That's not the coming cost. If we keep doing what we're doing and we keep adding new waves on top of the existing burden, these figures just keep going up. So last year was 1 and a bit percent of GDP lost. This year, probably a little bit more than that. Next year, potentially more again. How much more is hard to say at this point, but it depends what we do. In Australia, this is from the ABS. This data, we've had about 50% more Australians working fewer hours due to sickness than before COVID. So the light blue line, the high line, is people that worked fewer hours than usual. The darker line is people who didn't work at all. And the increase, from memory, I think we've got about 80,000 more people not working at all, and about 100,000 people working fewer hours. You're talking about 150,000, 200,000 full-time equivalent people taken out of the workforce. That's up to December 2022. So that's not counting this year. That's just last year. We've basically lost the equivalent of our entire immigration program in a normal year. This year's been pretty high, but the normal contribution that immigration makes is about what we've lost due to sickness in Australia last year. And then you can see how that flows through into different sectors. This is looking at workers' compensation claims in New South Wales. And what I've done is gone through the number of claims in each month by industry division. This goes over to the second page, I should mention, and they're not all increasing. We're looking at the number of claims each month by industry division, and then averaging them before the pandemic, and then comparing that to the average since we stopped trying to contain COVID. So we're skipping over the period between 2020 and when we gave up. Right. So while we were controlling COVID, there's some furloughing things going on. The work, some industries shut down, so there's less work happening. It's a little bit weird. So I've skipped that part, and we're comparing the let it rip period with the pre-COVID period, and we're looking at the number of workers' compensation claims per worker. So this is normalized by the number of people working in the industry, and you can see, in the arts and recreation sector, there's been 43% more claims on average each month than before COVID. In retail, 27% more. Education training has been an increase in 25% claims per month. Public administration and safety, which includes police and things like this, is 23%. And then information, media, and telecommunications also 22%. And these are sectors where they're public-facing jobs, where you're interacting with members of the public indoors, and there's not a culture of PPE. If you look at the next one, where you can see there's a significant reduction in the number of claims each month. In finance, they're often not facing the public, or they're working from home. Right? The number of people working from home has gone through the roof in these sectors, and so there's much fewer injuries. In mining, you've got a non-public facing jobs, but there's also a culture of using PPE, right? Respirators or whatever it is. So you can see the sectors where you can't work from home, you have to be in a room with other people. There's proper protective equipment is frowned upon. There's a huge increase in the number of injuries, and the opposite in the other sectors. One of the big things, actually, that I don't have good data on to do with lost productivity is how this contributes to inflation. When you've got all these shortages of people, shortages of workers, you have delays, you have other kinds of shortages, and that feeds through into inflation. I don't have excellent data on that, but you can see some things. The number of passengers, this is in Sydney, on the New South Wales Opal card data. The number of adults taking trips has fallen 50%. It fell to what, 5 million from 45 million. It's come back up, halfway. So this is, the amount of sort of economic activity happening in the city, I guess. People not coming into work, people working from home. You can see it in rent for commercial buildings. And you will have seen this in the papers as well. Business sector constantly complaining about people not coming into the office. They're right to complain from their point of view. The number of people working from home, obviously it skyrocketed at the beginning and then fell back down, but it's not coming all the way back. Other things have come back much further. Right? So we've still got about 30% of people, this is in the US, working from home. And it's not really returning, it's kind of stabilizing around that. And so, that has an effect on businesses in the city and things like this. Obviously, in my view, the way to deal with that is to make the offices and transport much safer so that people are more willing to come in. But if you're the owner of those buildings, that's a loss. We've had similar reports in Switzerland. This is not just a English-speaking thing. This is a global thing, basically. I think this is mainly focused on the IT sector in Switzerland. This is a little bit of other things in terms of productivity. I think I mentioned the arts sector as being the sector that had the most workplace injuries. There's also been a huge number of concerts and shows being cancelled. And one of the reasons this I found really interesting was the difficulty getting insurance for touring. And so this was the Who. And they were complaining that since COVID, they can't get insured. And if they go and do a tour, the cost of doing it, you earn the cost back over multiple shows. But he says, if you're doing a tour show run, you don't start earning it back until the 7th or 8th. But the trouble now is after the first show, you've got COVID and you can't continue the tour. And so you've lost all the money from the tour. So, this is one of the reasons that people are canceling a lot of things. There's a bit more of this kind of stuff. More people canceling. Bruce Springsteen, Robbie Williams. In China, we've got this whole sort of culture of lying flat emerging. There's reports that almost 50% of young people are out of work at the moment. I did want to touch on the last one being the increased health costs, and in particular in relation to the government. So this is from the budget papers, and just highlighting the amount of money we actually spend on health as it is. So we can see on the right, we've got health being the purple chunk of that sort of semi-pie graph. 15% of the government budget goes on to health. It's about almost 3 times as much as goes on defense. We've got 100 billion a year being spent by the federal government on healthcare. 221 billion a year by the country is how much Australia as a whole spends on healthcare. So almost half of it from Commonwealth budget. If you increase the number of people who have chronic health conditions, you're going to increase the amount of spending that you need to treat them. This is unavoidable. The budget as it stands includes an expected increase of 0.8% in real terms in health spending over the next 4 years. It's completely fanciful. You can't have a situation where you've got X% of people with multiple chronic diseases that they didn't used to have, and not expect that your spending on healthcare is going to go up.
Thank you so much for that. So, is it possible to quantify, do you think, how much work parents and mothers are missing to look after their sick kids at the moment, whether that's from COVID or other reasons?
Mm, mm. There is data on the amount of work missed due to caring for others. I looked at it today, and it didn't look like it had significantly increased. What it looks to me that's happening is that people tend to claim their own sick leave when they're looking after kids. So they're not claiming it as carrying allowance. They're just claiming that they're sick. That's my guess, because you see the increase in sick leave much more among women than among men.
Mm-hmm.
And my hunch is that you've got mothers, claiming to be sick when their kids are sick, to an extent.
Yeah.
That's a guess. That's not really in the data, but I mean, I should add, COVID does disproportionately affect women, so it's not that, and that's in the health data, not the economic data. But I think that the missed work is even more than that.
Yeah. What do you have any hunches on what sort of cost analysis work you think that the government is doing behind the scenes?
Not much is my guess. I know that anyway, one of the government departments, Australian Institute of Health and Welfare Analysis or something like this, they estimate the burden of disease looking through, they compare things using DALYs, right? The disability adjusted life years. And so they'll say how many years of life have been lost based on how many years before expected do people die, and then how many years of disability do people have. The trouble with that is that the disability portion of it is very backwards looking, and if you're talking about a new disease, it's very hard to have a forward-looking expectation of these DALYs if you haven't if you don't have future data to guess it on. So I sort of look at some of the studies that show an increased risk of heart disease, for instance, and I think Zayed Ali's study on the US veterans database shows, I think, an increased risk of, say, 50% for stroke. And if you then apply that to what's the disease burden of stroke currently, and add 50% to that, you can sort of get an estimate for it. I haven't done that yet. I've sort of partially done it, but those kind of costs should add up pretty quickly. But it's, if you want to say, what is the government? Is the government doing that? No, they're doing a very backwards looking thing. They're not looking, as far as I've been able to see, at what is the expected cost. They look at what cost has there been, and then they take this very optimistic view and say most people recover, therefore most people will always recover. I don't think that it is very rational.
So do you think that it would be better than if they were looking forward and doing some of these calculations, that they could be then comparing the cost in terms of lost productivity that long COVID and acute COVID are having versus the cost of implementing, transmission reduction strategies.
Yeah, I think that's ultimately what you need to do. You want to say, if we keep ignoring COVID, and people keep getting sick in waves, and a portion of each person of each wave adds onto the pile of people who are chronically sick, and that cost just keeps adding up, and it's dragging on the economy in all these other ways. If you look forward and project that, then you've got this, what I started with, this unfathomable cost coming down the pipeline. And what you want to do is not come up with a good treatment. You want to prevent that. If you look at, I said the US has already, last year lost about 1% of GDP. I think our population, we've had a similar thing, right, with about 1% fewer workers available. If you're talking about a 1% loss in the first year, and you've got a cumulative function, so it's going up, it's how quickly does it take before the cost of inaction is going to be much more than the cost of action? It's going to be very fast, right? By next year or the year after, we would have definitely been better off to have invested in a massive amount of prevention through ventilation, filters, stuff like this, and actually using it, like training people to know how to use it, making people aware to use it, these kind of things, right? The cost estimates I've seen for upgrading the indoor air safety of basically every school in Australia was about $9 billion. And I think from the if you apply an average salary to the number of missing workers in Australia last year, you get to about $7 billion just from that. And then if you look at, I mentioned $220 billion spent on healthcare. If you increase the demand for health by 1%, that's another $2 billion. There's your $9 billion already.
Yes, it's not just lost productivity; it's cost in other ways as well. How do you think that is flowing on in a personal level to things like the cost of living crisis and housing and things like that?
So there's a few ways. Part of the cost of living crisis is, I think there's three big things that are contributing to it. One is the climate disasters. So we've had a lot of floods here, with fires in the northern hemisphere, and that's hit especially hard on food producing places, including in Australia. And so then you get the shortage of food, and that has the same effect on food prices that the shortage of workers has on other things. Then you've had the war in Ukraine, and Russia deliberately bombing grain silos, blockading shipments. So that has a huge effect on grain prices. And then you have COVID as the third one, and that's had it. The role that's played has changed throughout the pandemic. At the beginning, the restrictions, especially in China, were sort of a stranglehold over international trade. Right? You had a big crunch in shipping because the ports just were closed, basically. But now it's not that mechanism. Now the mechanism is these delays and sickness and worker shortages. To the extent where this is not really a direct cost of living example, but when we talk about AUKUS, right, the defense initiative, the reason the senators in the US are concerned about it is because they're worried about how many boats can the US produce for their own needs, right? And their defense strategies call for 2 of the Virginia class submarines and 1 other submarine a year, and they're only producing, I think, 1.2 of those. Right? And the reason they say that they're falling behind is because their workforce is sick with COVID. And so, what do they want from Australia to say? You know, if we want to do this deal, we want to make sure that we're upgrading our own submarine shipyard capabilities. So Australia is offering to invest, whatever it is, $10 billion or something into US shipbuilding capabilities. But that's backfilling a COVID production shortfall. And so that becomes a national security issue as well as an economic issue, right? You're paying more for things, they're less certain, your capabilities are damaged, you know. So I mean that's a sort of example of how it feeds into costs. In terms of more household costs, um, uh, I guess the the big ones have been, other than food, you've had rent, obviously, and um, maybe power. Rent has been affected by migration, right? People have moved because of the moved around cities into regions, right? The work from home thing is upended where people want to be living. Um, so I mean that's had an impact. I don't think that's going to continue having an impact necessarily. It's sort of happened. It doesn't have to keep happening, but we'll see. Mm, People maybe still don't want to live in as much, like as many people per house, and that means you need more houses. Um, so that will push up prices as well.
So, like on a personal level, though, if the number of people that we that are living with long COVID is sort of projected to increase, and those people are working less hours and not working at all, and
Mm.
I'm not aware of any government support, financial support for people with long COVID because it's not covered by
Mm.
NDIS. Do you think it would make sense then that families would be, um, carrying their own financial burden, that would be then impacting, their spending and their housing?
Oh yeah, for sure. If you're, I mean, if you're sick, being sick is expensive. You have to pay for medicine. You have to pay for trips to the doctor. You have to pay for all the other healthcare things that come with it: tests, scans, drugs, blah blah blah. Doctors' fees not cheap. Um, especially at bulk billing rates these days. Um, and if the government is not contributing to that, or is only partly contributing to that, for sure that's going to land on people hard. And I mean, COVID is I mentioned teachers at the beginning, right? They're among the most frontline, most exposed people, and they're not amongst the most high paid people for sure, right? Whereas you saw the finance sector, the sort of health in the finance sector is better because everyone's working from home, so they're even more like the more wealthy people are more protected. Um, so for sure, the cost of being sick is landing on households.
And it sounds like it's landing on the households that can least afford to bear that burden. So people that might be at risk of homelessness and things like that.
Absolutely, and especially parents. Kids are one of the main vectors of infection because they go and play in schools, and that's all grubby and they don't have good hygiene. Um, and there's lots of people in a confined room for all day, and then they bring diseases home and infect parents. So and then that disproportionately affects women who tend to spend more time with kids than fathers. Um, it also disproportionately affects people with disabilities and other pre-existing conditions, who either because they're more vulnerable or less resistant, I guess is probably the way to put it, or because they're already closer to the edge, right? You have a sort of threshold effect where you can tolerate so much, and you get that straw that broke the camel's back kind of scenario. Here comes another condition, and it's a condition that weakens your immune system, and now you were hanging on, and now you're not. So for sure, it affects disproportionately women, people with disability, and by age, which are all protected classes of people. Right? So it should be something that the anti-discrimination regulatory bodies are dealing with, but they're not. I don't know I can't find out why they're not. But
We no longer have a sickness benefit available for people who are chronically ill but unable to claim a disability pension due to questions of permanency. What do you think will happen or is happening to the people and families who lose their incomes and livelihoods due to long COVID?
yeah, I mean, this is a really tough situation to be in, and I mean, my hope is that we sort out the income support, whether it's through the NDIS or through a different scheme. I mean, it's not sustainable for people, right? People are just getting absolutely wrecked by this. You know, it's not just if you look at in the UK, you've got they had a big survey of long COVID in doctors, and doctors were saying many of the same kind of things that Sarah and people from disability activists say, right? That it's wrecked their life. It's, you know, they're unable to work, they're unable to function properly, right? It's, you know, it's demolished their income. These are not, you know, people that were not high performing before, right? These are very high performing people, and they've been smashed by it. They're not, you know, lazy people, leaners. These are like, I mean, it's hard to get into medicine. It's hard to be a professional doctor, and you know they've been smashed. It's the same across many sectors, right? So this is something we're going to absolutely have to deal with. We're going to have to work on. We're going to have to find treatment somehow. We're also going to have to find economic support, but we're also going to have to prevent more and more of this, because you know eventually you can't have an economy where, you know, 10 or 20, 30% of people are just, you know, knocked out. You can't have a society like that.
Mm. Which is, of course, also not measuring at all the suffering that's involved as well.
Right.
Just the cost.
Right.
Yeah.
I mean, right. I mean, you know, in one sense, the economy is essentially the aggregate of people's individual welfare. You know, that's what it's supposed to measure, even though it doesn't really get recorded very accurately. But you know, if you think separately from that, you know, you've got the experience of living, and then you've got you know, how do businesses function. You know, those, neither of them are going to make it if we keep just having everyone being sick all the time.
Mm. So do you think then that there's an opportunity for the government then to do something proactively and sort of turn the situation around?
Yeah, absolutely. You know, the government can do several things. One is, we already mentioned, improving the indoor air quality of schools. That would be a fantastic one, just because that's such a big nexus of transmission. And you could seriously, you know, remember back at the beginning, we all talked about the effective rate of the R naught or RF, right? The effective rate of, if you can get that down below 1, you're dandy. And if you can knock out the big transmission points, you know, that's going to have a big effect on that. So if you can reduce the infectiousness at schools, that would be great. Likewise at hospitals, for a different reason, because that's where the worst consequences happen, because people are already the most vulnerable, right? Sick people go to hospitals, and so you don't want to be spreading disease at hospitals. You can also improve, you know, invest in better PPE. Right? People don't really like it, but in certain circumstances, like you're going to want it. Also, better and more available, like personal filters. Right? If you don't want to be wearing a mask, have your own portable filter. That would be great, especially for teachers, or you know, if the schools are not providing them, I'd be bringing my own. They're not super expensive. I think you can get a personal one for about $100, maybe a bit less, depending on postage. In terms of other things the government can do, the sick leave, you know, especially for casuals. You know, the Victorian government has done that for some sectors, but I think that's a pilot scheme or a trial program or something, and they're looking to get it matched with the federal government. that needs to continue, because you can't have, people not being able to take time off work if they're sick, if they're infectious, right? If you're infectious, you have to be able to stay home, and if that means losing a shift, people are not going to do it. So you have to find a way of having a kind of income, like a insurance market, or income support for people who are sick, even if they're casuals. And I guess the other thing is really just about education, right? People have completely lost track of what's happening here. And we've got this enormous cost coming down the line. People don't understand it at all. They don't understand how it's transmitted. The government keeps talking about washing your hands instead of avoiding indoor air, or wearing a mask. Um, Getting the communication right is cheap as hell. Like they're talking already, so they're already spending the money to talk sometimes, but they're saying the wrong things. So it doesn't cost you any more to say the right things. Right? So that's very cost effective. So, but it's not just the PM or the health minister or the chief health officer, or whatever it's called, that has to do it. Departments are expected to ensure that their sort of responsible areas understand the risks. Right? So, for instance, the Department of Education needs to be talking to principals. The workplace, Safe Work Australia needs to be talking to employers, and needs to be talking to the subunits of the regulatory agencies. Everyone should be talking down the chain and making sure that the people who are answering to them understand the risks that they're obliged to mitigate. It is already in the law. It's in the workplace safety law for sure. Right? People are required to do whatever they can reasonably do to minimize risks. And these things are reasonable to do. Right? It's very easy to install an air filter, and it would reduce the risk significantly. It's very easy to improve the ventilation, especially if it just means opening the window. And people aren't doing it because they don't understand. And so that kind of communication is very cost effective.
Well, thank you so much, Dominic, for joining us on Between Two HEPAs. We really appreciate your super informative talk. And yeah, thank you very much.
Great speaking with everyone. Thanks very much.